Maharashtra and Gujarat have maximum caseload. Hospitals may be overwhelmed by the end of May, with increase the demand for hospital beds and healthcare providers. There will be increased need for ventilators. India is manufacturing ventilators at a high rate. This creates the need for specially trained staff to care for the intubated patients who are on ventilators. In such situations, the best alternative method to handle is non-invasive ventilation. Non-invasive ventilation is the delivery of oxygen via a face mask, helmet, and therefore eliminating the need of an endotracheal intubation. The helmet is a clear plastic hood that contains the patient's head and is joined to a hard plastic ring supporting a soft silicone collar. Two pipes connect expiratory and the inspiratory limbs of the circuit to the ventilator or wall gas. NIV helmet avoids 20 to 35% intubation, as mortality in intubated patients is 70 to 86%. NIV helmet prevents spread of virus within the treatment facility, as it is a closed system with the use of viral filters. 20 to 35% patients will avoid intubation. Takes up to 1 to 2 hours to identify if patient needs intubation. Can be used without a ventilator, connected to fresh gas flow. Can be used in a non-ICU environment. We have developed indigenous helmet using 3D printing technology and has been tested, which has a polycarbonate 3D printed ring with silicone neck collar which is airtight, vinyl transparent hood which can withstand PEEP till 20 centimeters H2O without air leak. As it is easy to assemble the helmet and install on the patient, only 2 nursing staff is required with minimum training. Few nursing staff can manage multiple patients at a single given time. Now, how to install it on a patient? First, measure the neck size of the patient. Cut the silicone neck collar according to the template. Attach the ventilator inspiratory and expiratory tubing to the helmet. Set the ventilator to pressure support mode with PEEP of 8 and FiO2 to 60%. Stretch the silicone collar of the helmet and place it over the patient's head and secure the straps. The helmet pressurizes in seconds. For removal of the helmet, the straps are detached and the helmet can be easily removed from the patient. The helmet can be attached to blender with flow meter, wall oxygen with medical air, ventilator, CPAP and BiPAP. The parts for wall gas, the inspiratory limb can be connected to the medical air, oxygen, flow meter. The expiratory limb is attached to the viral filter and PEEP wall. 20 to 30% of the patients will avoid intubation. Helmet NIV compared to face mask NIV in non-intubated patients with acute respiratory failure and ARDS reduces ICU and hospital direct variable costs along with intubation rates, length of stay and mortality. A large scale, if used, will be very cost effective. To order NIV helmets to support us as volunteers and funding to provide NIV helmets to hospitals in need, contact us, or also you can email us.